Day zero is the moment before company formation, when a founder decides to take the plunge, follow their dream, and commit to pursuing their vision of change. On day zero, you'll hear founders tell their story. From the initial idea, through reactions by critics and skeptics, setbacks and successes, we'll cover it all. Behind every company is a founder with ambition, goals, dreams, and wisdom to be shared. Let's explore them together.
Hi, everyone. I'm Tarun Kapoor here with Day Zero, and I'm very excited to introduce you all to Dr. Alison Darcy, who is our guest for today's session. Without further ado, I'm going to let Ali introduce herself. Ali, please welcome.
Hi. Thank you very much for having me. Yeah, my name is Alison Darcy, and I'm the founder and president of Woebot Health.
All right, so right off the bat, I think we need to talk a little bit Woebot Health. That's an interesting name. Tell us a little bit about the company, what you do, and what you're doing today, and then we'll kind of explore how you got to where you are today.
Sure. Yeah. Woebot Health is a digital therapeutics company. We make digital behavioral health through relational technologies in particular. And our therapeutics right now are delivered by our relational agent, who is called Woebot, which we'll talk about how we got that name. But we built a suite of products basically to support people who have symptoms of anxiety and depression. There is a solution for postpartum depression that we're hoping to send through FDA clearance, and also for adolescents as well.
All right. So this is not something that you just came up with recently. This is something you've been thinking about and passionate about. Can you tell us about how this first percolated as an idea, and when did this all start?
Sure.
In your thought process?
There was a number of things came together. One of those was just the knowledge of what was happening outside of the lab and sort of the ivory tower, I suppose. The reality of the numbers of people suffering in the population just going through the roof at a much faster pace than we had expected as a field. The knowledge that we don't have enough resources to deal with everybody, and that actual sort of fundamental architecture of therapy is not scalable. I started to really believe that sort of our system around mental health care is not just not scalable, but it's kind of flawed from a design perspective, and that the architecture, the basic design of what a session looks like had been, I guess, could be traced back to sort of the Freudian era, the 1890s, but we have never really evolved beyond that in a meaningful sense. And I just thought, for in particular young people and various subgroups, God, therapy is like just a bad design in lots of ways. Not the therapeutic process itself, but the architecture around it, the structure, the needing to go to a clinic, the limitation around it being, one-to-one interactions and things with another human. Much of it, and then of course the those things that keep it somewhat, stigmatized. Frankly, really hard to find a practitioner. It takes a lot for somebody to reach out and get help.
It's so fascinating. You brought up the Freudian piece, right? Because it never even kind of dawned in my head. Wait a minute, yeah, we're doing something, quote, the couch, right?
Yes.
Right. And the couch. Well, the only way to do the couch is to physically have a couch, and maybe the fundamental problem is, and I think, is this fair to say? The fundamental assumption that you're challenging is it doesn't require a couch, or it doesn't require an office. Is that fair?
I think, well, that's right. I think so. I think that there's a role for the couch and there's a role for the office, but there's also a role for these other things. And I don't know where along the line we became obsessed with the fact that there's like the archetype of therapy is one thing, and it is two people in a room around a couch, the proverbial couch. Actually, there are so many approaches that do better in term. I think have the potential to be better implemented through a digital format, and because of the nature of what they're trying to do. And one, cognitive behavioral therapy, in my view, is one of those therapies. And I recently, and it comes down to the model itself is based on enabling people to gather information that that challenges a negative worldview that they might have of themselves, the world, and the future.
Mm-hmm.
And I was recently rereading Beck's original therapy manual that was published in 1979. And in it, Aaron Beck actually suggests that therapists do home visits so they can be by the side of their patient as they deal with their day-to-day struggles, such that they can sort of coach them through that opportunity to say, let's challenge your thinking, let's challenge your thought process around what's happening right now, and so they can replace it with something more balanced and objective. Well, I think there's no therapist is really doing home visits, right? That's very rare. But that's the role of a Woebot. A Woebot is there as that person is living their life in that moment where they are faced with something that, honestly, sort of is defeating or crushing them, or making them feel really powerless, and can talk them through, okay, what are you feeling now? So that's the problem I went to solve, was not, could I make a digital therapeutic that digitizes CBT? That was a solved problem. Lots of people have done that. But can you do it in a way that really engages people meaningfully at that key therapeutic moment?
So, Ali, and I think you've just hit on another theme that, as I've had an opportunity to do some interviews with other founders and co-founders, you hit on, that is, don't just take the current process, put digital on it, and now it's a right. No, right. That doesn't solve.
That's right.
That doesn't solve the problem.
That's right.
Understand the underlying problem, and you and your team spent a lot of time on this exact point, not trying to just digitize an analog process, but actually creating a new architecture, I think is the term you use. Can you talk us through a little bit? Well, even the title Woebot, right? I asked you, where did you come up with this name Woebot? Because it doesn't quite click in my head, because we've heard of other happy terms out there.
I know, that's right.
Where did this Woebot concept?
Frankly, that's kind of all of us, right? We all have mental health, and we all need to look after it. But when you're really struggling with depression, the last thing you want to be told is to, just be happy or be a better version of yourself and all this stuff. And actually, when the name for me was kind of tongue in cheek. It's a pun, but it's also about approaching the problem with just a touch of humor, just a touch of we don't have to be so professional heavy, so kind of I'm not articulating this well, but as you can tell, it was quite an instinctual name that I thought was funny and would enable. Well, what I observed when working with people was that actually a bit of humor in your practice does help to move the work along, because a lot of this work is frankly not fun, right? It's not that entertaining or fun to explore your most negative belief systems about yourself and things. These are heavy things. And so a bit of humor allows us to sort of move with that and go into that process a bit more readily. So that's where the name came from.
The other theme that I think I'm hearing you talk about is, tell me if you concur or disagree with this, is a lot of times it's either or in digital, right? Digital is going to replace analog. You have kind of, is that you're looking to blend those concepts, right?
Oh, absolutely. Yeah, absolutely. I see this as, there's often a narrative around replacement, and because Woebot is a conversational agent or a relational agent, it seems like, well, you're just trying to be a therapist, and actually that's exactly not what we're trying to be. Now, that doesn't mean that Woebot isn't informed from and teaching and guiding people through solid cognitive behavioral therapy principles, but Woebot is explicitly not a therapist. It's Woebot's is showing up as a peer, as a person who is by your side, as an ally, truly an ally. And that is a different role, because they're there, in the middle of the night or what have you. But it's obvious, and that's why we also chose Woebot. The very robotness of the name is intentional. The kind of the robot archetype look and feel, all of that is intentional, so that it is its own thing and never mistaken for being a human, and never trying to be a human, because that is, human connection is something very different, unique, and precious. And what Woebot does is as a utilitarian role, but it also is ensuring that the person understands that really there is no person there, allowing them to, again, engage, allowing them to disclose, what might be something very dark for them and difficult. And nonetheless, I think the beauty of it is when you come through a process, that person implicitly understands, I did this. This Woebot didn't tell me anything I didn't know about myself already. They just asked the right questions. I have the resources. I actually went through a process. And I think that's a win for me, because I think the best of cognitive behavioral therapy is very self-directed.
Yeah. And so you formally founded Woebot. How long? It's been how long now?
It was 5 years. So yeah, it was 2017. I was working on the problem earlier. But it was 2017. And I didn't answer your previous question you asked, which I meant to get to, but I stopped. The whole point about that process being distinct from a therapeutic process is that they actually sit side by side really complementarily.
Yeah.
So Woebot is this really great tool that enables people to engage in some of the skills that their therapist is teaching them. And it just works so beautifully where we've had engagements where we've seen, therapists refer their patients to Woebot, and they come back and say things like their patients come more ready, more engaged in therapy with them. So yeah, that was just to loop back and answer your question.
So the reason I asked about, it's 2017, you clearly knew COVID was going to happen. That's why you set it up. Oh my goodness. Now, can you help guide, the listeners out there? How have you had to pivot Woebot, do stuff different at Woebot, given now that we knew about the mental health, but it was never exposed to this extent, and now here, what have you had to do differently with Woebot coming out of the pandemic?
What we saw was an acceleration of the infrastructure and the world around us. It was really intriguing. Within a few weeks, we no longer had to have a discussion about the merits of digital, and it was just implicitly understood and adopted. We think back on the ludicrousness of clinicians not being reimbursed at the same level for a telemedicine appointment as a regular appointment. It seems archaic to us now because the time that they spend is exactly the same. But though that was the reality back then. So I think we saw an acceleration of adoption and also the people's conversation. Just the zeitgeist changed fundamentally, and everybody, I think there was a global acceptance, I would say, as universal as we've ever seen it, that everybody has mental health and everyone has to deal with it. And it was very dramatic for us for those of us who had been working in mental health for the longest time, to suddenly find mental health the topic of everybody's, on top of mind. And this I think just was a very good thing, even though, obviously we don't love the circumstances that got us there. So in many ways, actually, what we had to do was keep our head down and keep building. So, and that's what we did. We actually didn't shift our pipeline. We sort of stayed more resolute. And from that point on, it was sort of head down, keep going, right? And in the knowledge that, what we do is meaningful and important.
And now the other end of that question, it would be the acceleration, the rapid adoption of digital, I would say formats, architectures for healthcare. Now, the other end, I would say, a question would be is a lot more economic uncertainty in the world today. How are you having to pivot Woebot, or are some lessons learned so far that you could share with the listeners, things that you need to think about or you have to think about differently as there's more economic headwinds that folks are running into?
Well, we're very, very fortunate in the time that we raised relatively recently. And but and we've always been frugal, we've always been lean, and I think now you're especially care to be sort of fiscally responsible, right? You just have to be very strategic around the resource allocation in the company, and ensuring that we all do good work and don't become comfortable. I mean, I think as a startup, you never really are just sitting back and breathing a sigh of relief and thinking, yeah, we made it. Like, that's just not, that as a startup, by definition, you're never at that point. And I think what's happening, what we've seen as a result of the pandemic, and probably as we move into, sort of a new economic climate, is the argument around cost and the infrastructure around healthcare spending may be shifting. It's still shifting. I think that the sand is shifting under our feet. And, we just have to be more discerning and even more strategic around demonstrating sort of cost savings around what we do. You have to be realistic and think, there has to be an ROI. And of course, we believe it as people, right? But it is the challenge, because things like preventative care or earlier intervention may not have that immediate ROI that lends itself very well to just, an easy sort of commercial argument or business case. But it just drives the creativity of the team, frankly. And I actually think alongside this sort of economic shift is a genuine acceleration of people's thinking around the fallout from negative mental health. And, so alongside this stuff, alongside the maybe, shifting macro is also an expansion of people's understanding of where mental health negatively impacts the bottom line in all kinds of contexts. It's not just mental health as this niche thing. It's people are realizing mental health has a role in all health, in all chronic, you can't really disentangle the two. And so I think the world is really shifting.
Yeah. So before it's, listen, I need to pay for this exact visit. And maybe now it's, I need to care for my employee population because I need to retain them. And that's a different value point. Is that a fair statement?
Yeah, that's right. I think that's right. And I think, honestly, there are additional arguments that we haven't seen before and that are very welcome, in that people are saying, no, hang on a second. There has to be some equity and inclusion here. Like, we can't just treat, you can't just have great access for one group and then the others are ignored. What about people in rural areas? And, and so I think where the world is moving to more equitable access as an overriding principle, digital solutions have to become part of that.
So just before we close out, a couple of thoughts I want to explore with you. Being a founder is not easy. You're not only you're a sole founder, right? A lot of times we have talked to co-founders. Can you maybe share a little bit what are some of the toughest things you had to go through, or even how your construct of how you get through the tough stuff that keeps you going? It's like, oh boy, because sometimes there isn't always a shoulder to
that's right.
to proverbially anything on. So how do you pull it off, Ali?
You lean into the problem and you think, well, it's not about me. This isn't about me or the company. Like this thing needs to be solved. And when you sort of take yourself out of it, it's a little bit easier to just keep going and, to calibrate to doing the right thing. As the company has grown, of course, I think what keeps me going now is, at the early days, it was the problem and solving the problem. Now it's the problem in the context that is complex and juicy, and the people that we have in the company around the table solving it side by side. I think we have some incredibly brilliant and talented people at Woebot Health, and I can't believe it. They're so interesting as well. I mean, I am sitting here in Dublin, and just when I think of the engineers that are here, one of them was an archaeologist before, another one was a Ph.D. in French literature, And then they're all incredible musicians and, like concert level musicians. And it's, and of course, when I think about that, I think, well, yeah, they're the builders, and they, of course, they come from interesting backgrounds, because what we're solving is so human and so, so plugged into like creativity, as well as great engineering, and as well as great clinical theory and science.
I cannot think of a better way to land our conversation. So just again, Dr. Alison Darcy, on behalf of the team here at Day Zero, thank you so much for taking the time and sharing your insights with us.
Thank you so much for having me. It's been really great.
Have a great one.